An area of concern that is coming up more and more these days is narcissistic personality disorder. You may have heard this on TV, within social media, or during discussions with family and friends. You may even believe you know someone who is narcissistic. I want to take this opportunity to better explain narcissistic personality disorder and to tie it to some of the strategies found in my book, Life in the Past Lane: Learning How to Focus Forward. The specific strategy being awareness and a willingness to make adjustments. I gathered some information from the Mayo Clinic to help explain narcissistic personality disorder in greater detail. Narcissistic personality disorder, one of several types of personality disorders, is a mental condition in which people have an inflated sense of their own importance, a deep need for excessive attention and admiration, and a lack of empathy for others. But behind this mask of extreme confidence lies a fragile self-esteem that's vulnerable to the slightest criticism. A narcissistic personality disorder causes problems in many areas of life, such as relationships, work, school, or financial affairs. People with narcissistic personality disorder may be generally unhappy and disappointed when they're not given the admiration they believe they deserve. They may find their relationships unfulfilling, and others may not enjoy being around them. Treatment for narcissistic personality disorder centers around talk therapy. Signs and symptoms of narcissistic personality disorder and the severity of symptoms vary. People with the disorder can have an exaggerated sense of self-importance, have a sense of entitlement and require constant, excessive admiration, expect to be recognized as superior, even without achievements that warrant it, exaggerate achievements and talents, be preoccupied with fantasies about success, power, brilliance, beauty, or the perfect mate, believe they are superior and can only associate with equally special people, monopolize conversations and belittle or look down on people they perceive as inferior, expect special favors and unquestioning compliance with their expectations, take advantage of others to get what they want, have an inability or unwillingness to recognize the needs and feelings of others, be envious of others and believe others envy them, behave in an arrogant manner, coming across as conceited, boastful, and pretentious, insist on having the best of everything, for instance, the best car or best office. At the same time, people with narcissistic personality disorder have trouble handling anything they perceive as criticism. They can become impatient or angry when they don't receive special treatment, have significant interpersonal problems, and easily feel slighted, react with rage or contempt, and try to belittle the other person to make themselves appear superior, have difficulty regulating emotions and behavior, experience major problems dealing with stress and adapting to change, feel depressed and moody because they fall short of perfection, have secret feelings of insecurity, shame, vulnerability, and humiliation. What are the causes? It's not known what causes narcissistic personality disorder. As with personality development and with other mental disorders, the cause of narcissistic personality disorder is likely complex. Narcissistic personality disorder may be linked to the environment, mismatches in parent-child relationships with either excessive adoration or excessive criticism that is poorly attuned to the child's experience, genetics, inherited characteristics, neurobiology, the connection between the brain and behavior and thinking. What about risk factors? Narcissistic personality disorder affects more males than females, and it often begins in the teens or early adulthood. Keep in mind that although some children may show traits of narcissism, this may simply be typical of their age and doesn't mean they'll go on to develop narcissistic personality disorder. Although the cause of narcissistic personality disorder isn't known, some researchers think that in biologically vulnerable children, parenting styles that are overprotective or neglectful may have an impact. Genetics and neurobiology also may play a role in development of narcissistic personality disorder. Complications of narcissistic personality disorder and other conditions that can occur along with it can include relationship difficulties, problems at work or school, depression and anxiety, physical health problems, drug or alcohol misuse, suicidal thoughts or behavior. When looking at prevention, because the cause of narcissistic personality disorder is unknown, there's no known way to prevent the condition. However, it may help to get treatment as soon as possible for childhood mental health problems, participate in family therapy to learn healthy ways to communicate or to cope with conflicts or emotional distress, attend parenting classes and seek guidance from therapists or social workers if needed. As I indicated earlier, the strategy of awareness and a willingness to make adjustments, which I've discussed in my book, Life in the Past Lane, Learning How to Focus Forward, may be a helpful beginning to promote a change in narcissistic behaviors. If you recognize some of the signs and symptoms, the next step is a willingness to make some adjustments in your life to make things better. What will you do differently to make things better for you and your loved ones? Please take a look at my book, Life in the Past Lane, Learning How to Focus Forward, available on BookBaby and Amazon.